Observation versus ER. My question is simple. When there is a 760 observation charge on a claim with a 450 ER charge as well, that claim is no longer an ER bill, correct? And in the answer, there's more of a description of what the person was asking, a little more detailed. Didn't want to put it all on that first slide. She went on to say, I can't get clear answers. You can really tell when you're getting feedback from a coder versus getting feedback from a coder with a billing background. My question is simple, which we read earlier. The patient status has changed to observation, and since the claim was coded with an observation, the claim should be processed as an observation or outpatient, not an ER bill. I had a coworker that believes that the claim is still an ER bill because the observation hours were under 23. I tried to explain that the observation would dominate the ER because the patient's status changed and it does not matter how long the person was in observation. Is this correct? As we scan down the page, for Tiffany, that was a little play for Maureen because she's got the controls. Tiffany is correct. It has changed status to an observation. So I went in and pulled some information. I got these little skew here. Specialty services. It goes in to say charges for patients requiring treatment room services or patients placed under observation. Patient's reason for visit should be reported in the conjunction with, and these codes are Volume 3 codes, so not ones that you're probably used to looking at if you're an outpatient coder. Only the 0762 should be used for observation services. Observation services are those services furnished by a hospital on the hospital's premises, including use of a bed and periodic monitoring of a hospital's nursing or other staff, which are reasonable and necessary to evaluate an outpatient's condition or determine the need for a possible admission to the hospital as an inpatient. Such services are covered only when provided by by the order of a physician or another individual authorized by the state licensure law, meaning like PAs and stuff like that, and hospital staff bylaws to admit patients to the hospital or to order outpatient tests. Most observation services do not exceed 1 day. Some patients, however, may require a second day of outpatient observation services. The reason for observation must be stated in the orders for observation, and payer should establish written scrolling. I can hear Lorraine typing. That's funny. Oh, wait, go, just, okay. Guidelines that identify coverage of observation services. So, in other words, you need to check with the payer. Now, that's giving you a description of outpatient, and most hospitals in their outpatient services will designate how many hours that is. So, you know, that's what this other person is thinking. Oh, it wasn't enough hours. Now, for the ER room, though, charges for emergency treatment to those ill and injured persons who require immediate unscheduled medical or surgical care. Observation or hold beds are not reported under this code. Okay? They are reported under Revenue Code 0762, scrolling down. There we go. Observation room. Oh, I thought there's a little more in there. So Tiffany was correct in what she was saying. If a person comes into the ER and let's say they suspect appendicitis, the blood work came back, but not quite elevated enough on a white blood count. They've got pain, they've got nausea and vomiting, but they're just not sure. They don't want to take them in and open them up unless they have to. So what they're going to do is not keep them in the ER. They'll go ahead and hold them into observation because they're pretty sure it's going to go ahead and be something that needs an appendectomy. But until that point, they're going to just keep them in observation. They are no longer in ER status. As soon as they turn them into an observation status, that is what you're going to code for, observation, not ER. Timing doesn't really matter on this. There's rules that individual hospitals have or different insurance companies may have, but it's all based, the codes are all based on the status of the patient, not the time of the patient is that they're in the ER or in observation.
Get more CPC exam tips, coding certification training, and CEU credits. Go to www.codingcertification.org.